Welcome back to another episode of the podcast, Brain Hope Reality. I'm your host, Eugene Lipov. I have not done that for a while, multiple reasons. We are back with an exciting guest, Ahna Mikl. I don't know if I pronounced it right. So maybe you can kind of talk
Sure.
about yourself and how we met, and we'll have a good conversation.
Yeah, thank you. Thank you. Thank you so much for having me. It's an honor to be here. And yeah, so my name is Ahna Mikl. And yes. And I come from the world of all things health. So I'm a birth doula, a detox specialist, and a regenerative health practitioner. I just like to say that I help women understand that healing is possible and help women really heal like on a root cause level and show them that it is possible through my own healing and through my own journey. And um, yeah, I'm very much so happy to be here and
Thank you.
happy. Yes, yes, thank you.
Well, thanks for having coming to the show. And the reason I asked you to come to the show, obviously
Hmm.
you and I met, and we can talk about how we met. Obviously, I know something about psychiatric issues and injections and stuff, and we'll talk about that.
Yeah.
But I thought we had kind of simpatico connection as far as women's health.
Hmm.
And for those of you who might not have heard that, the reason I'm very interested in women's health, not being a woman myself, clearly,
Yeah.
as you can see my beautiful hair. Um, my mother took her life when I was an intern in surgery.
Hmm.
So I'm very interested in mental health in women
Hmm.
and how to optimize that and how to increase function of women. So, self reliance, I think it's really important. Being able to not blame yourself. A lot of times there is a physiological change in your body that a lot of times people don't
Hmm.
understand.
Hmm.
Childbirth is a very traumatic time. So
Hmm.
when I did OB anesthesia, I always said having a child physiologically, we're not talking about all the fluffy stuff, but it's like having parasite in you. It sucks
Yeah.
up all your energy, it sucked up iron, whatever, but also hormone switch has a huge impact on the brain. And you need
Hmm.
to respect it and deal with it. And we'll talk
Hmm.
about some ideas. We're talking about it also cover infertility. Infertility affects women significantly, and unfortunately, our society, I think we're having more and more of that. And
Hmm.
there are some therapeutics which are effective, some are quite expensive still,
Yeah.
but it also has a significant effect on self-image. It also has effect on the family.
Hmm.
So, with that intro, let's talk about it. So, why don't we start of how you actually found Stella Center or me? How we talked about having an injection. Obviously, we don't need details; just very broad strokes would be perfect.
Yeah. Yeah. So, um, yeah, I really feel like God led me to Stella. I had heard certain things about the stellate ganglion block and started to see it in my dreams. And I was like, oh, okay, I'm supposed to go get the stellate ganglion block.
That's interesting.
And yeah, and for me, much of my life, I struggled with symptoms related to post traumatic stress injury or post PTSD. Um, but I didn't really know it. And I was kind of, yes,
PTSI, possibly?
PTSI.
PTSD.
Yes.
That's exactly
And
right.
yeah. And just struggled with a lot of health symptoms a lot of my life and was like chasing certain things to manage those symptoms.
Right.
And, and for me, the nervous system dysregulation was the biggest piece. And, uh, coming
What do you mean by
from
that, do you think?
what do I mean by the nervous system
No, no, no,
dysregulation?
no. Right. What is it to you when somebody says
Oh,
nervous system dysregulation? A lot of people who are listening may goes like, what? What is that?
yeah.
What does that mean
Yeah.
to you?
For me, it was, and I didn't even really I couldn't even recognize that that's what it was. But I struggled with IBS, constipation, severely painful menstrual cycles. I had hair loss, hormonal imbalances, all of these like physical symptoms that I think a lot of women struggle with. A complete disconnection from my sexuality, um, just a lot of physical symptoms that can then be tied back to the nervous system,
Right.
and just this general feeling of not being safe, of hypervigilance. You know, everywhere I look, everywhere I turn, it's like I was, constantly tense.
How about feeling of doom? Did you have that? Something
Yes.
bad is going to happen?
Yes. And the deeper that I went down my path of healing, and the more memories that surfaced from my past, it was harder and harder for me to ignore the hypervigilance because it got so loud. And I had tried everything. I mean, I'm a detox specialist, right? So I did the detox, I did the meditations, I did chiropractic. I mean, the list goes on. Yet I still couldn't convince my body that I was safe.
Right.
And so that's really what led me to the stellate ganglion block. And so I too would kind of love to know from your perspective, like from a science perspective, why is that? Why can we be trying, using all of these tools, but still not, right? You can't like convince the body that it's safe because it feels like it's stuck in the past.
Yeah, so I'll give you a specific answer to that. So
Yeah.
the way I look at the word is, so if you look at the brain, people talk about the reptilian brain, right? So the fish, the reptile, and the neocortex. So,
Yeah.
So the fish brain is kind of brainstem. Reptilian brain is the emotional brain, or technically limbic system. Neocortex is what makes us different from dogs, for example. So if you peel the neocortex off, there is really the brain is the same in a dog and a human. There's no real difference. So if you abuse a dog, they will have, they call it VPTSD, veterinary PTSD. So a quarter of the dogs, and I'll get back to your answer.
Yeah.
Quarter of the dogs that were deployed in Iraq developed VPTSD because they had trauma, and now they have symptoms such as they can't sleep, their personality changes, they're submissive or aggressive, they're hypervigilant to noise, and so on. So the same symptoms. In fact, the first time I ever treated a dog was in 2009. I can send you a YouTube link on that.
Yeah.
And it actually worked, which was pretty cool.
That's amazing.
So if you think about, so let me give one more piece of information, which is kind of interesting. So there is an exotic tumor called pheochromocytoma, which I assume you've never heard of. It's 1 out of 10,000 people get it. This because what happens is it's a tumor that produces norepinephrine. It's a brother of adrenaline or epinephrine. And there are 3 symptoms. Most common symptoms: high blood pressure spikes. So it's like we're talking about 220, 260, very high. Headaches. And number 3 is feeling of doom. That's why I asked you about doom.
Yep.
If you cut that tumor out of the adrenal, feeling of doom goes away. What it says, what it means is that when people who have PTSD, their norepinephrine levels are too high. Right? And it's been shown in studies. So if you're interested in like sciencey stuff, read my paper in 2009 on my website, drugenelipov.com. But so if you look at the perspective norepinephrine system, that's the sympathetic system. If you fly running away from the tiger, what happens? You don't need circulation to your fingers. You don't need circulation to your toes. You don't need circulation to your nose. You certainly don't need circulation to sexual organs. You're just running. It needs to go to big blood vessels.
Right.
So if you look at people coming off climbs, when they froze, they're losing their fingers, noses, and so on. Right. So it also does the same. It reduces circulation to the intestine. You don't want to be digesting. Thus, you can have IBS.
Right.
You need a certain amount of circulation to the uterus to have normal periods. If that's always high, you're going to have very painful periods. Also, in order to conceive a child, you need to have endometrial thickness of 7 to 8 millimeters, which is about this big.
Mm-hmm.
If you have continuous high level of norepinephrine, it's only 2 millimeters.
Oh,
There's
wow.
no
I did not
place
know
to
that.
implant, right? There's no place to implant.
Yeah.
So fertility rate will be much lower, right?
Wow.
So
Yeah.
there was a paper written in 1972 in Italy. Cost me $700 to translate it, which I'm still annoyed with. Anyway, so they took 50 women who had irregular periods and they were infertile. They did
Mm-hmm.
stellates. Half of those guys got pregnant,
Wow.
right?
Wow. Yeah.
So 85% of men with PTSD develop sexual dysfunction,
Mm-hmm.
and it does respond to stellate. So if you look at the norepinephrine levels and sympathetic overactivation, pretty much the symptoms you described, like hypervigilance.
Mm-hmm.
If you're running from the tiger, you want to be looking around, right? You don't get
Mm-hmm.
eaten. You certainly shouldn't be reproducing. You can't be getting laid when the tiger is going to eat you, so that's not good. You want
Right.
to be in hyper. You should respond very rapidly to any kind of stimuli because you can get
Yeah.
eaten.
Yeah.
So you're sitting comfortable, but you asked me why can you not, like you do chiropractic position, you took all the talk therapy in the world.
Mm-hmm.
Can you convince your heart to go slower? Like, no, heart, go slower. No. I mean,
Mm-hmm.
there are caveats to that, of course. The point is, the part of the brain you need to talk to chill out is the limbic system. And typically people don't have that. Now, just to make it more complicated, there are
Mm-hmm.
3 neurological structures I want to tell you about.
Okay.
The neuroscience is pretty complicated. It's only 3 things you need to know.
Yeah.
PFC, prefrontal cortex, which is right here. Hippocampus, which is what controls the memory,
Mm-hmm.
part of the limbic system, and amygdala. So when bad things happen, amygdala lights up and tells you to run. So amygdala hits the pedal of the metal and you start running.
Mm-hmm.
So that's kind of the basic PTSD thing. But if you can increase the function of hippocampus, it suppresses amygdala. So a year ago, a news station asked me, why would playing Tetris video game help PTSD? I was like, I have no idea. They sent me a paper, I looked it up. It turns out playing video games, specific ones like Tetris,
Yeah.
activates brain function hippocampus, and that suppresses amygdala. If you play Mario Brothers, it can activate prefrontal cortex, and that suppresses amygdala as well.
Interesting.
Right? So if you meditate, it can grow your prefrontal cortex, and that
Yeah.
can suppress part of the amygdala.
Right.
Right?
Okay.
Isn't that interesting how it's all
All
connected?
interconnected. Mm-hmm.
Right. So feeling of doom, all it is, you're feeling norepinephrine. And it's probably adaptive. If you think about it, if the tiger is sitting next to you, you have to be in high alert all the time.
Yeah.
It is a price to pay for high alert, though.
Yeah.
Long-term stress will kill you.
Yeah.
People with PTSD have twice the risk of heart attacks and so on.
Yeah.
The other part is this type of trauma or continuous trauma or having PTSD
Yeah.
can be given down to 2-3 generations unless you treat it through epigenetic transmission.
Right.
Right?
Right.
So not treating it, you're not doing yourself any favors. Also, you're not doing much good for your kids and your grandchildren.
Right.
Plus, we live in misery. Besides that, it's a great plan.
Yeah. 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 So you're basically, I mean, because like coming from the birth world as well, like I mean, I believe maternal health is really the foundation of the world. I really do. And I feel like we're kind of stepping into a time where maternal health is going to be, it really is going to be like front and center, or it needs to be front and center in order to heal, to really heal future, well, to heal us now, but so that we don't pass these things down to future generations.
Yeah, exactly. So, yeah, for example, how many women are addicted to vaping and things like that?
Mm-hmm.
What that does is reduce circulation to the uterus. So you have
Mm-hmm.
smaller babies. They're sicker babies and they
Mm-hmm.
die earlier and whatever, right?
Mm-hmm.
And then if you're stressed, so if you have PTSD, for example,
Yeah.
that increases the chance of postpartum depression by a factor of 2 or 3, which we'll talk about.
Yeah.
So And also, if you have PTSD, your baby is going to come out smaller and less well, because PTSD also affects the immune system.
Yeah.
If your mother gets sick, then the kid gets sick, and so on.
Right.
So ideally, mental health is, mental health, at least in this country right now, it's the worst it's been since 1941.
Mm-hmm.
So it's the
Mm-hmm.
highest suicide rate since 1941. Preteen suicide is on the rise. I
Yeah.
mean, it's like,
It.
we're not even talking about the military aspect, right? That's another story
Mm-hmm.
altogether.
Mm-hmm.
But if you just look at women's health, and fertility is a very sensitive thing. You need a lot of things going right.
Right.
For example, I don't know if you know that, but if women have an orgasm, the chance of conception goes up to factor of 2.
Yeah, I wanted to kind of go into that actually, like the orgasm piece, because
Right.
I think, you know, I personally went the majority of my life without ever being able to.
Right.
And many women, this is the story for many women, but it's not something that we're talking about openly when we need to be.
Well, exactly. It's like, ooh, another taboo point. But
Right.
to me, it's physiologic, right? So,
Right.
I mean, but think about it. Why do you think orgasm helps conceive? Have you
Well,
thought about it?
because right, we're expanding the energy in that area. It's like
That's a little foo-foo for me. What it does, sorry, it produces suction. So
okay.
the stuff that's mixed where it needs to get mixed
Yeah.
gets up to the endometrium. Once it gets to
Ah.
endometrium, then it gets stuck, right?
Yeah.
So the thicker the endometrial wall, the easier it is to implant. So if you're not stressed, instead of 6 millimeters, it's going to be 8 millimeters. So
Hmm.
once the thing gets there, it gets stuck and it gets the energy it needs, and poof, you have a child.
Right.
I have to
Wow.
tell you a cutest story though.
Yeah.
So I had this gentleman who was a firefighter, marvelous man. Anyway, I treat him. He does great. His PTSD goes away. Everything's great. He calls me
Yeah.
up 2 years later. He says, "Hey, Doug, we got pregnant." I was like, "Congratulations." I don't take a sexual history ever. It's like none of my
Yeah.
business.
Yeah.
He said, I don't think you understand that. I said, well, all right, tell me about it. So he and his wife had tried to get pregnant for 10 years or 15 years, something like that.
Wow.
Right? So I couldn't get pregnant, da, da, da. And then I do the procedure and they conceived the night after the procedure.
Wow.
Right? So he calls me back and he says, that's thanks to you. I said, well, first of all, I had nothing to do with it. That's all good. I'm glad it helped. Guess what they call the baby?
The
Jordan.
name, what is it?
Jordan, for Michael Jordan.
Oh.
Isn't that cute?
Yeah, it is cute. I like that name.
But think about the mechanistics, right?
Yeah.
So if norepinephrine levels are too high, the male equipment does not work so good. If
Right.
it's too low, nothing. If it's optimal, then the equipment works well.
Yeah.
So theoretically, at least,
Yeah.
I think his sexual function improved, thus potentially into orgasm, thus potentially into conception.
And would you say too, like the parasympathetic piece as well? Because like
Right.
in order for our reproductive parts to even be working.
Well, they're both are there, right? They both need to work. But the
Yeah.
other thing is, if he is not tense, his wife is not tense, all
Yeah.
the right things are relaxed the way it's supposed to be relaxed,
Right.
and it works the way it's God built it, right? I mean, it
Yeah.
should be just normal function.
Yep.
But
Oh, beautiful.
but you see how it all kind of connects?
Yes.
So
Yes.
everybody's relaxed. Like one of my buddies that I treated said, it's like, and I talked to his wife. He said, yeah. And he's great, but the temperature in the house is going down. Instead of walking around on eggshells, now it's like, oh, okay, hi, have fun. Everything works better that way. Everybody's
Yeah.
relaxed, including the children, because
Yep.
children pick up emotional energy very rapidly, right?
Exactly.
It's a
Yep.
cycle.
Yep.
So that's part of a big thing I believe in. We should treat not only the person's PTSD, but the spouse and the kids.
Right.
Because my mother got PTSD from my father. That's called
Mm-hmm.
secondary PTSD.
Mm-hmm.
But if you treat both of those guys, it changes lives completely, which is
Yeah.
really amazing to see. And I've seen a lot of that.
Yeah. And I would say too, to that, I just even think about like how many, right? How many neurons, I think that's what I would, yeah, like neurons are created, right? In infancy and the
Well,
baby.
hopefully a lot.
Yeah. I mean, millions, millions and millions, like every second. And so it's like babies are always attuning to mother and father.
Right.
And
Well, they're
so, yeah,
designed that way, right? So there is
yeah,
something called echoneurons. I don't know if you've heard that term.
no.
So echoneurons, there was a cute experiment somebody did, I think in UCLA. They took people, college students, paid
Hmm.
a minimal amount of money, put them in a scanner, and they put people right next to them in another scanner.
Hmm.
And one got electric shock, and the other one didn't. And they
Hmm.
scanned the brains at the same time, and
Hmm.
they found the same changes in the brain of somebody who was observing as somebody who got shocked. So we
Wow.
resonate to another human being. So if you think about the children, especially, they resonate very much. They can feel.
Yeah.
They're all born empath because they need to understand how to deal with their parents, even
Right.
if they're verbal, right?
Right.
As you get older, like I'm an empath,
Hmm.
which
Too.
having run a trauma unit, let me assure you, not a good thing to be.
Yeah.
I wouldn't recommend that for a trauma surgeon.
Yeah.
No, no bueno.
Right.
Um, but you can see how that is all connected. That's so I
Yeah.
always tell people is like you think about secondary PTSD like STD, you can catch it from your partner. It goes back and forth. So if you treat one
Absolutely.
but you don't treat the other, it's going to come back.
Mm. And yeah, that's so interesting and makes so much sense. And kind of also going back to just like the sexual function piece, just because I know a lot of women are really curious about
Yeah,
this.
yeah.
Um, Especially in like women's bodies, like many women are numb. Like they feel numbness, which is also why, because they just can't get into a relaxed enough state, and there's so much trauma and stored emotions in the genitals and the reproductive.
So let me ask you a question about that. I used to
Yeah.
actually run a section in a hospital that the focus was pelvic pain, so I'm familiar with that.
Okay. Yeah.
And child abuse and all of
Yep.
that. That's another story altogether. It's pretty
Yep.
much when you say numb, what do you mean numb exactly?
Numb as in can't, like
I
literally
can't
numb,
relax.
like can't relax, can't feel pleasure.
But that's different. That's dyskinesia. Then different to me. Like somebody tells me they're numb, it
Yeah.
means if somebody touches that, they feel nothing.
Yes.
They
Yes.
feel that. It just there's no
Oh,
pleasure from stimulation. That's what you're talking about.
yeah, I'm
It's,
talking about that. Hmm.
right.
Have you seen like any changes in success stories around
Well,
like after people
honestly,
getting?
I don't ask.
Yeah.
But let's do the extreme version of it. Have
Yeah.
you heard the term vaginismus? You know what that is?
Yes, I've heard of it, but I haven't dove
It's
into it.
basically vagina is very tight. The
Oh,
continuous
yes.
constricted. It's continuous constriction.
Yes.
It could be because of sexual assault, could be whatever.
Yep.
So theoretically, we think that that's a defensive posture, right? So if you can
Hmm.
get somebody out of defensive posture and you can relax, it's
Hmm.
all about relaxation.
Hmm.
So in somebody who has that kind of a problem, so
Hmm.
there's quite a bit of physical therapy that women get done for that.
Yeah.
But I think Stellate Ganglion Block would help that.
Yeah, I do too.
Because if you can reduce sympathetic system, the fight and flight system in general,
Yeah.
we find much more effective therapeutic intervention with psychological therapy because people don't get overactivated. They can stay calm, they can stay present, which is all important,
Right.
right? Because if you don't, it doesn't really work. And
Right.
and it's also it depends. The sexual dysfunction piece is to me, it's still
Hmm.
a limbic dysfunction.
Yeah.
If you are driving 1,000 miles per hour and trying to survive, and somebody's trying to get hot and heavy with you into your pants, it's not going to go anywhere, right?
Right. Right.
So until that's fixed, you can say,
Uh-huh.
well, it's my vagina problem, it's my clitoris problem, whatever. Da. But
Yeah.
I don't get into that. But
Yeah.
the point is, I think you need the biggest my saying when people talk to me, which is thankfully rarely about sexual dysfunction,
Yeah.
The biggest sexual organ is your brain. Everything else is interesting, but until the brain is fixed, it's not going to work.
Yep.
Obviously, if somebody has it blown away, different problem. But if
Yep.
everything is still connected until you get the brain calm,
Yep.
right? So
Yep.
that's why the whole symptoms of it's like scented candles. By the way, the biggest aphrodisiac smell that you can try.
No, what
What
is
do you
it?
think? What do you think? Take a guess.
I mean, I would say like the smell of your partner, but what is it? I mean, that's kind of what I think.
I don't know. There was a study like that. Anyway,
Okay.
so they said apple pie
Interesting.
because it brings
Because
you
it,
back to relax,
yeah.
calm. Plus, if your partner didn't take a shower, it's like, yeah, you're nice, but get a shower first, buddy.
Yeah.
My point is, it's not as consistent. Apple pie doesn't need to take a shower.
Right.
It's
Right. Always
consistent.
smells the same. Yeah.
Right. It's consistent. But the point is,
Yeah.
scented candles, lavender, whatever. So,
Yep.
I mean, if I was going to do anything in the space, fortunately, I don't. But like lavender smell, I think is marvelous. Things
Yeah.
like that, because that reduces your system. In fact, you can use Aura, which I think you're wearing Aura ring as well, right?
No, I'm not. No.
Anyway, but my point is, you can potentially look at your arousal state, like not sexual arousal, but heart rate variability,
Mm-hmm.
right? HRV, all of that. Potentially, you can tell what shape you're in for sexual function just by ordering.
Yeah, that
Because if
makes
your
sense.
HRV is low, doesn't matter the smell is, nothing's going to happen, I don't think.
Right. Right. Yeah. It's biological, or would you say it's biological?
Well, I call it physiological.
Physiological. Yeah.
But it's adaptive, right? Again, if you think of in perspective, you're running from a tiger, what do you want it to do?
Yeah.
You don't want, if you cut your finger, if you don't want to bleed to death, you want to cut down the circulation.
Yep.
It's designed to get the main whole home.
Yeah.
You certainly don't want to be distracted by erotic images when you're trying to run.
Right. Right. No, I'm so happy that you went into this because I think it's going to, I mean, I truly believe that SGB is going to change the lives of millions.
I agree with you.
Yeah, millions of people. And I will even say, like, since I got it, which was about 2.5 weeks ago.
Oh yeah. Any changes you've seen?
Yeah. So it's been a period of very, very deep emotional work for me since I received it. I've been able to sleep though. I've been able to sleep, which is huge because
that's a huge thing.
Because I, as I uncovered layers of my past and I would have nights of consecutive nights of no sleep because my body could not get out of a state of hypervigilance. Like
Right.
I would see a shadow,
exactly
right? It was, and so it's helped me so much in that realm. And then I've been able to actually work through memories of my past and release them.
Well, that's the whole thing. You get access to that. So
yeah,
actually, let's talk about a couple of things that may be interesting for you.
Yeah.
So I don't know if you've heard the term lymphatic
Yes.
system.
Mm-hmm.
Cool.
Yep.
So for those of your listeners who don't know this, so
Yeah.
lymphatic system is when you drain from the extremity typically. Lymph is what's basically when you're thinking, you're producing waste product and it gets stuck in the brain. And the way to get rid of it, you need to be in stage 4 or deep sleep. So you can sleep for 20 hours, but not deep, and it's still stuck in your brain. So basically, the waste product in the brain is still hanging around. You're not going to be you're going to be kind of out of it, right?
Right.
So that's why Oura Ring or Fitbit, things like that, can give you what deep you're in, what deep sleep you're in. So, like for example, you can meditate right before you go to sleep.
Mm-hmm.
Or one of my favorite things I recommend is yoga nidra.
Yeah.
Right? Bioscan. I think that's like the best thing. So because it gets you in the right phase where you can do something about it. And you sleep better. And then when you're more relaxed, you're not stressed, right?
Yep.
So when you're awake, you can process, hopefully, the stuff you're processing.
Right.
So let me tell you a story. I call it the story of the two brains or two memories. So there's two types of memory. There is emotional memory, there is functional memory.
Okay.
Emotional memory lives in amygdala, the same part of the brain that controls fear. Hippocampus is factual memory. So there was a guy in Philadelphia who did the study. He had access to a patient who had, everyone had a hippocampal stroke. So they had all short-term memory loss. So he can meet the same person 10 times a day and it'll be a new stranger for him every time, right?
Yeah.
So he showed happy memory, happy movies to 10 people or 20 people. 2 hours later, he said, how do you feel? Happy, feel great. Why? Not a clue. Next day, showed them sad films, like videos.
Yeah.
How do you feel? Very sad. Why? Not a clue. So the point is, amygdala remembers it. So stellate seems to deactivate the amygdala and activate the hippocampus. So you can get access to emotional memory, which has been locked away from you. You couldn't process it.
Right.
So then you can actually deal with it.
Right. And release it.
I think that's really, to me, like a super cool thing.
Yeah. And I mean, and that I'm so glad you talked about that, because it's like, you know, I went the majority of my life with these repressed, had everything repressed because I was living in survival. And until I got the ganglion block, I mean, truly, it has freed me in so many ways. I've been able to,
That's so cool.
yeah, I've been able to forgive. I've like, just a few days ago, like I reached that like state of like, no, like I am not my past, and healing is possible. And, you know, it's all the lessons that I learned from what I went through. And I really, truly wouldn't have been able to get to this point without it. But the thing is, I'm still feeling like everything kind of detoxing out of my system still.
It takes time. But
yeah,
the good thing is you see a future, right? It's
I do.
So one of the things I always tell people, it's like my mother took her life. She had no hope.
Yeah.
But if you have hope, again,
Yep.
people don't usually kill themselves.
Right.
And, you know, it's not, PTSD is not a lifestyle. It's a condition that's treatable. It's not a disorder, whatever the hell that means. Nobody knows what that means.
Yep.
It's a bunch of various things that are physiologically treatable. So that's how I look at the word, right?
Yep.
It also has other potential things like immune system impact, GI impact, all of that.
Yep.
And it's all connected. Because if you think about your colon being tight is IBS.
Yep. Yep. No, it's so good. Yeah. And that's the best way to say it. Like I have hope for the future. You know, I'm not like paralyzed, right? I'm not paralyzed by the fear anymore. Like I understand now that was just a lesson, the fear, you know, and it's just allowed me to even process emotions that I couldn't process before. Like I couldn't access.
But exactly. You couldn't process it because either there were too much or you couldn't access it at all.
Yeah, I couldn't access
it. Your body is trying to defend you because there's so much, it's over.
Yes.
So I usually don't like to make, I've done a podcast that was 4 hours before. I'm not trying to do that. So I thought, if you don't mind, the next 5-10 minutes, maybe we can talk about possible project you and I talked about, trying to treat postpartum depression.
Yeah, absolutely.
So to me, I've had 2 or 3 patients I've treated with that, and that seemed to have worked well for them.
Yeah.
So advantage of Stellate Ganglion Block, or DSR, which is a more advanced version, is you had DSR, not SGB, by the way. Just so you know.
Oh, because I got both sides.
2 levels. No, 2 levels on one side.
Okay.
You had 2 levels.
Okay. Good to know.
Believe me, I was there. Believe me, that's what you had.
You did it. Yeah.
Absolutely. I knew it was there. Anyway, so postpartum depression is a huge problem when it happens because it disrupts the family, it disrupts the connection between the mother and the child.
Yeah.
A lot of problems happen. The other thing is treatments, like you cannot really take, or most women don't really want to take psychiatric medication because it'll affect the child. Also, psychiatric medications takes months to years to work. You just don't have that time. The golden period, I think, is about a month to 3 months. Right. Yeah. So the cool thing about DSR or stellate ganglion block, it works. If it works, typically works almost immediately. And you can pump and dump for 8 hours, so to speak. So you're not going to fail the child. You really don't have to technically, but if you want to, you can do that. It's not a long period.
Yeah.
And the intervention is rapid, which is great. So we are talking about potentially finding women with that and potentially treating them.
Yes. Yeah. Which is, kind of goes back to what I was saying earlier too. I just think about like maternal health, right? And how important that is. It's huge. It's everything. And many women struggle with postpartum depression, I think. And we,
Right. Well, some more extreme than others, some this, some that. But my point is, if you are proactive, so part of it is education. So this is what I'm hoping you can help me with. Is somebody has a history of postpartum depression in the past, and now they have another child, there's a pretty good chance there's going to be another one.
Yep.
Also, if somebody has a history of PTSD, that also increases the chance of postpartum depression. So that's a risk factor. And you're prepared. What are you going to do if it becomes bad?
Right. And I think too, from that perspective, and just like what I've seen is after a woman has a baby, we're more, I mean, there's so many reasons for this, but it's like we're more emotionally open. And a lot of things come up in that time period. It's like almost like a rebirth in a sense for women. And so I feel like also too, postpartum depression is more common. What do I want to say? Maybe not more common in women that have experienced things in the past that they haven't worked through, but also, yes.
I think that's true. I think it's true because there are some sciencey explanation for that, but I think if you have a mental health instability, any kind, before birth, because if you think about it, the estrogen goes up and it plummets. Right? So estrogen actually has some really interesting effect on sympathetic nervous system. So we never talked about that. But if you think about it,
interesting.
If you take out ovaries in young women, the blood pressure goes up. You give them estrogen, blood pressure goes away. Right?
Yeah.
So women develop PTSD is twice the rate compared to men with the same trauma. So I believe women usually drive on a higher sympathetic system, and estrogen was developed by the man upstairs to control sympathetics. So when you have this high thing, the sympathetic system gets wonky.
Right.
So if you look at hot flashes, right? So this is the first time I used stellate ganglion block for something outside normal stuff was hot flashes, not PTSD.
Yeah.
And then, so when women's estrogen goes down, hot flashes start, right? If you give them estrogen, what happens? Hot flashes stop.
Right.
When you stellate, hot flashes go away.
Wow.
Same thing. It's all sympathetic.
Same thing. Yeah. Yeah, it is. And would you say too, for women in the postpartum, and maybe I guess we're kind of looking for people, right, that would benefit from this treatment so that we can study it. But as far as like the mother and the father, it'd probably be beneficial for them both from a family dynamic perspective after, or would you say it more important?
Well, I think shmaybe. My technical term. My favorite term, rather, shmaybe.
Yeah.
Science and shmaybe is my two favorite terms. So it depends. So if everything was fine, if they had a normal relationship, and then a woman develops this, if it lasts for years, I think they're all in trouble. So both should be treated. If you can treat it early, like when I was a surgeon or surgical resident, do you want a small tumor or do you want to have a big tumor? You want to treat the small tumor. The point is identify early, treat early.
Yeah.
High blood pressure, same thing. Do you want it to be for 20 years or you want it to be 6 months?
Yeah.
If you can treat it early, it depends. It depends, also not everybody develops PTSD. Some people just don't. Whatever you do to them, you just don't. But but the point is, if you have a level of suspicion, then it's a different problem. right? So
Yeah.
let's say a woman comes out of it. Now the guy doesn't get in the bed with her. It's like, oh my God, is something wrong with me? And he feels
Mm.
bad because his
Right.
sexual function is no longer there. I'm
Right.
thinking you should think about PTSD at that point.
Yeah.
If they're lovey-dovey and everything's great, we're not treating anyone. Why would you
Yep.
treat somebody? My
Yep.
point is, having a level of suspicion is worth it.
Yeah.
And then children, like I've done children as young as 8 years old, it depends how traumatized they are.
Mm-hmm. Um, for the women listening and the women I'm also going to share this with, I'm curious, like from your perspective, how early on after pregnancy, after they have their baby, could they get this treatment? Is there any time?
Yeah, well, I mean, you don't want to do procedures in pregnancy,
Right.
and that's more
But
medical legal. But let's say I've never done one pregnancy, and nor am I going to.
yeah.
Theoretically, you can start a week later.
Okay.
Yeah, it doesn't really matter. So to me, I used to run trauma units. I worked in ERs, all of that.
Yeah.
So the point is, you identify a problem. Why are you waiting to treat it?
Yeah.
Because as soon as you treat it, better you're off.
Right.
Because
Right.
the damage, because bonding of a mother and a child is a huge thing. I think people don't really realize how important that is.
It's everything.
Right? And then you have the family units forming. The idea is everybody is loving, da da da.
Mm-hmm.
But then if a woman is not bonded to them, because oxytocin is God made that, so you get the lovey drug, right? Everybody's
Yep.
lovey-dovey.
Mm-hmm.
If that's interfered with, then the family is not as tight. So when you have children screaming, problems happen, then people get annoyed with each other.
Right.
As opposed to, oh no, he's my lovey-dovey, it doesn't matter what happens.
Yeah.
So you can tolerate much more craziness when you have good bonding. So to me, if you can
Yep.
improve bonding,
Mm-hmm.
you're doing great. Especially
Yeah.
if it's something simple, you don't have to keep doing it all the time.
Right.
That doesn't mean it's going to work on everybody. It's probably, my guess success rate will be 70, 80%.
Yeah.
That's a big number, right?
It's huge. That's huge. And thinking about oxytocin, I mean, oxytocin, in my opinion, is like the biggest anti-inflammatory of them all. Like truly, in like the human body, from a healing perspective, which is why I wanted to talk about like orgasms earlier and everything too. No, you would say differently.
I'm not aware of that super duper anti-inflammatory. The best anti-inflammatory is still cortisone. That comes out of adrenals.
What is it? Cortisone?
Cortisone.
Okay.
Cortisone. That's what adrenal. I mean, that's our natural anti-inflammatory.
Yeah.
Oxytocin is great for bonding. It's designed, but it's like lovey-dovey hormone.
Yeah. Yeah.
But anti-inflammatory, I'm not aware of that. Maybe I'm
Yeah,
wrong.
you might want to. Yeah,
I'll
maybe
look it up.
look it
I
up.
don't know.
Yeah, because like part of my training and the schooling I'm in right now is all for like sexual healing and also maternal health and postpartum health and just how important oxytocin is.
Oh, no, I'm not debating that. I think it's great.
Yeah, but
I agree with all of that, except that oxytocin itself has anti-inflammatory impact. I'm not aware of it.
Yeah, I'd be curious.
I'd
be curious for you to look it up and let me know, because that's kind of what I've been learning. And I was like, oh wow, that makes sense, right? So like when we think about just how orgasms are so healing for women, well, it's also because we've got like oxytocin just flooding the body.
Let me give you a different thing.
Okay.
This is the part I understand.
Yeah.
So let's say you're stressed, right?
Yeah.
There is a direct connection from the stellate ganglion to the uterus, to the adrenal, to the thymus, which controls the immune system, and the bone marrow.
Yeah.
So if somebody has orgasm, they're calm, collected. Now their stress level goes down, so the thymus starts to work better. T cells.
Yep.
Bone marrow, B cells.
Yep.
Right. The adrenal gland is no longer pumping out all this cortisone because it's stressed.
Yeah.
Baseline.
Yeah.
The immune system starts to function much better.
Yeah.
That'd be my thinking. That's not a direct effect of oxytocin. It's an effect on all the other symptoms. Because if the brain goes, oh, he's so loving-doving and my body is so relaxed, that's great, because now the body doesn't have to be in defensive mode. Now, there's no tiger eating you. You're okay. Nothing wrong with you. You're
Yeah.
okay now. Now the body says, I can function not like a normal body. I
Right.
can have sex, I can have orgasm, I can reproduce, I can
Yep.
eat. I don't have
Yep.
this tightness in the pit of my stomach. My
Right.
colon's not tight.
Right.
You relax. All the little muscle that should be relaxed are not relaxed.
Hmm. And when
The
we're relaxed,
umbilical or regular.
yeah. And then the other piece too is like I think about my own healing is like when I'm actually relaxed and in a parasympathetic state, well,
Yep.
that's when my body releases all that doesn't serve me. It releases the,
Exactly right.
and then that's when we can find freedom. It's when we
So
can
now you
truly
have
find freedom.
access to all those memories that you no longer need. You can say, well, it would
It's in the
happen.
past.
It's over.
Yep.
Bye bye now.
Yep.
I don't
Yep.
have to be tied to them. I'm here where I am.
Exactly.
I'm having great life, and all the other memories. Bye bye now. I don't need to be with you anymore.
Yeah.
Let them go.
Exactly. Yeah. No, this is just it's super exciting. I'm so excited to share more updates. I posted like a video
That'd
and
be great. I'd love to see it.
yeah, yeah, and people are really really curious because I would say almost all of us are dealing with some form of
Stuff.
stuff. Really,
It's
really
happening,
and
right? The
and
stuff is endless. Besides all our societal craziness now,
yeah.
some of it is self-induced because of memory and self-judgment, all of that. So if you
Oh
can
yeah.
relax that,
Yep.
think what kind of better life you can deal with the craziness better if you're
Hmm.
in better condition.
Exactly. Yeah, I'm excited to share this with more and more people so that it gives them hope they can heal.
I love it. That's the
Truly.
key.
Yes. Yes. And women in, the postpartum period especially, couples struggling with fertility, like there is
Yeah,
hope.
absolutely.
There's hope.
I think,
Yes.
so we'll be interested in, so part of what I'm trying to do is get some information and publish that so people start thinking about actually, other clinicians can start thinking about doing that.
Yeah. Beautiful. Yeah, I will be sharing this and
Thank you. Maybe we can change a bunch of women's lives and
we sure
families,
will.
right? Nobody is happy if mama is not happy. So we need to fix the
Exactly.
mama.
Exactly. Exactly. That's what I say too, and the postpartum period often gets dismissed or, it's
Oh yeah, of course.
we worry so much about like the pregnancy and, pre-pregnancy um and then we're worried about baby, right? But baby's going to be fine. We have to worry about mom.
Right.
Mom
If
is the
mom is miserable, she's gonna make baby miserable.
right.
If nothing else for the milk, because the milk is gonna have norepinephrine in it, and baby is gonna be not happy.
Right.
Oh,
Right.
absolutely. It's all connected. I mean,
Yeah.
even though you're out of the placenta, it's still connected. Even if you
Yep.
don't touch them, they feel
Yep.
emotional mood, and that's not good for the kids if the
Right.
mama is not in a good shape.
Right. Yeah. Yeah,
Yeah.
so I'm super excited to share this with more women. I
Cool.
think it's really going to change millions of lives. I
I hope
believe it.
so. Well, it's like considering my mother's death, I'm very interested in making that happen.
Yes.
Any final thoughts? And I don't want to bore people to death.
No, no, people are going to love this. I can guarantee that. I'm trying to think if I had any other questions, but I think we covered the majority of them.
Perfect. Well, we
I'm
can do
just
a
I'm
second
so
one later. How about this? Why
yeah.
don't we see how it goes? And let's plan to do another one 6 months.
Yeah, that's perfect. And I know that this is still working in my body. So I'm excited to kind of come back and share where I'm at, even in just a month. Like I know
We can
that
do a
it's going to
month.
look
Sure.
differently for me. Yeah.
I have a room ready to go for you.
Amazing. Thank
Thank
you.
you. Have a great day.
You too. Thank you.